The essential characteristic of this disorder is a disruption in the functions of consciousness, memory, identity, or perception. People who have this disorder suffer from amnesia, depersonalization, derealization, identity struggle, and identity alteration. Symptoms experienced are intrusions into awareness and behavior, accompanied with losses of continuity in subjective experience. There are many different symptoms that must be present in order to diagnose a person with this disorder. There are three essential symptoms that must be present. The first one is the presence of two or more distinct identities or personality states that control behavior. The second is an inability to recall important personal information past the ordinary forgetfulness. The third is the disturbance is not due to direct psychological effects of a substance or a general medical condition.
The cause of the disorder is very controversial, and there are many different theories on how the disorder is caused. The first theory is biological, which includes genetic. The theory states that relatives who have the disorder are more likely to be influenced by the disorder. Social, cultural / environmental changes are said to cause the disorder. The lack of support or comfort from family or friends can be a reaction to trauma and a way to cope with it.
So for the treatment of dissociative identity disorder, there isn't much consensus on which treatment is the best, especially the therapy route of treatment, because there's no true way of knowing whether or not an individual is faking the disorder or is actually diagnosed with it. Most research suggests that the phase-oriented approach with concrete guidance during therapy is the best way to treat the disorder. First stage deals with skill building, and so that's going to help the patient deal with high risk and dangerous situations that can come from having dissociative identity disorder. The second stage is focused on trauma-based cognitive therapy if the individual is said to have the disorder based off of a traumatic incident, and help reduce the cognitive distortions that can come from the trauma and the disorder. And then finally, the last stage of the therapy treatment would be individualized to the patient and the severity of their dissociative identity disorder. And so there are some medicines that can be used to help treat dissociative identity disorder, but most of the time they're used for comorbid diseases, which means that there are two or more diseases or disorders that the individual has, and then also to target the relief of particular symptoms that are found within one of the altered personalities of the disorder.
The legal issues involving dissociative identity disorder are very controversial given the self-reported nature of the disorder. Can we truly give credit to someone as a witness when they are suffering from the disorder? The court cases involving dissociative identity disorder are heavily disputed, and there's three specific problems in the judicial system that they must address when they're involving a case with someone with dissociative identity disorder. So the first problem or criteria that have to fall is the individuals with dissociative identity disorder may accuse others of abuse but lack concrete evidence and base their accusations off of memories from one of their multiple personalities or identities. Second, there are unanswered questions revolving around the civil and political rights of a person with dissociative identity disorder. Which person can represent the person in a legal case? Is it their true personality or the personality that was active when the crime was committed? Finally, individuals with dissociative identity disorder may deny liability of the crime because it was committed in a different personality or identity state other than the one that they are normally in.
Environmental changes are said to be caused. One theory says that an individual with relatives who have dissociative identity disorder symptoms are more likely to be influenced to have the disorder.
Deregulation. Can you truly give someone credit for telling? I messed up.